Okay, members. Sittings resumed. We now move on to questions to the Minister of Finance, and I call first of all Andrew Muir.
Well, Mr. Speaker.
Minister.
Cancora, just before I answer, I had the opportunity to be in the chamber yesterday, and I just want to add my condolences to the family and friends and colleagues of Christopher Stalford. It's a very sad loss. I think we'll all be poorer for his passing. In relation to the question, I have noted the views of the Fiscal Council and their view that the Department of Justice have done less well than other departments when considering the combined impact of the required 2% savings and the general allocations provided. However, it is worth noting that the Fiscal Council's assessment did not take into account the other significant funding that was proposed for DOJ in the draft budget, namely £44.4 million for the PSNI and £10.7 million for the work on reducing and preventing domestic and sexual abuse. Further to this, DOJ would also continue to receive the security funding, which provides £31.2 million per annum for the 3 years outlined in the budget. Of course, many pressures remain throughout this budget process. I have highlighted the significant financial challenges we face. It simply remains that the funding available to us falls well short of what is required. As such, we must prioritise expenditure. On this issue, the Executive has consistently indicated that the priority is health, and the draft budget reflected this, with the Department of Health receiving additional funding significantly above that received under Barnett. To do this, savings from other departments, including the Department of Justice, were necessary. I welcome the views of the Fiscal Council and indeed all the respondents to the draft budget consultation. These will be fully considered as and when the final budget proposals are developed. On this issue, it will be imperative that the Executive works together collectively to find solutions to the financial challenges faced.
Supplementary, Andrew Muir.
Thank the Minister for his response. The reality is that we don't have any budget for the next financial year, never mind the next 3 years, and also the Fiscal Council's findings in relation to the impact upon justice was clear. Does the Minister agree with me that we not only need a budget, but we also need a budget that keeps our communities both safe and healthy, and will he reconsider his decision to terminate the consultation on this draft budget?
Well, I agree with him in relation to that we do need a budget. We need to ensure that an executive is in place to do that. I have taken advice in relation to whether we could proceed through this Assembly chamber with a budget. That's not possible, I'm advised. And I absolutely agree with them. We need to ensure communities are safe and protected. I have paused the consultation on the budget. I haven't terminated it. And there still is a facility in the Department to receive input if people do want to continue to make their views known in relation to it. But there is no point in putting departments and other public bodies through the process of responding to a budget when the Executive is not in place to do anything about it. But I would hope that sense will prevail and that we do return at a very early opportunity to dealing with the budget properly.
Philip McQuiggan.
Minister, the Independent Fiscal Commission said that a multi-year budget provided a golden opportunity to reform public services, including to reform and improve our health service. Would you agree with me that it's actually disgraceful that this golden opportunity has been jeopardised by the DUP's reckless and selfish decision to collapse the Executive?
Well, we've long recognised that the health service needed support in terms of dealing with the big issues in cancer treatment and waiting lists in mental health provision. We have also recognised that in order to transform the health services that we have long wanted to do, that would require multi-annual funding, so there could be recurrent funding to allow us to employ the staff that are needed for that. So there was the opportunity now, after a long number of years, to do that, to get this agreed. And to have that certainty given not just to the Health Department but to a whole range of department and other bodies who rely on funding through executive departments, and that certainly isn't going to be there, I think is a huge wasted opportunity. I could see if there was some logic in this, if the idea to pull out of the Executive was actually influencing the protocol negotiations, but they're going on regardless of what is happening in this institution. So surely the logic is to come back in, get the Executive working and try and ensure that the only people who are being punished, ensure that it isn't the case that the only people who are being punished as a result of the stance of the people that we collectively represent.
Rose Kelly.
Sorry, I've been called the wrong spot altogether. But in terms of the recommendations for the budget, The Department of Justice obviously is saying that in terms of both prison service, but more particularly the police service, which, as you know, as I said before, Minister, does deal with vulnerable people. So could you tell me, just in terms of what representations you have had, even recommendations from the Fiscal Council in relation to dealing with people with vulnerabilities right across the piece?
Well, the Fiscal Council didn't get into making any recommendations in relation to the budget. They did note that the Department of Justice was particularly pressed, and I recognise that if we were going to make the big commitment that we wanted to make and that all parties had agreed should be the priority for health, that was going to put strain on other departments. None of them are receiving a reduction. They all received an increase, but not at any level that they would need to do all of the important things that Justice does. We had the opportunity next year, because we had about 300 million additional pounds to take into next year to allocate to try and ease some of those pressures, and that would have been very important, I think, for justice and policing, certainly for next year to supplement their budgets, but we're not now having the opportunity to do that either, and that is regrettable.
Call McNesbitt.
Question 2.
Minister Long wrote to myself and executive colleagues advising that the Chief Constable Simon Byrne intended to defer the March 2022 PSNI recruitment intake as a result of the draft budget proposals. Members will be aware the Executive has prioritised the health service for financial support during the next budget, and my draft budget is reflective of this. That said, the draft budget provides DOJ with an increase of 2.9%, 3.9% and 3.3% over the baseline in each of the respective budget years. Additionally, it makes specific provision of 14.8 million in each of the budget years to maintain police numbers at 7,100. It was my intention to consider the public consultation responses and bring forward final budget proposals in March. However, with the resignation of the First Minister, this is not now possible. Without an executive, there will not be a budget, and this creates greater difficulties for departments delivering public services. On this issue, it is imperative we come back together as an executive and we work collectively to find solutions to the financial challenges faced, produce a final budget and ensure that all the funds we have available are effectively utilised.
Supplementary, McNesbitt.
I thank the Minister for the answer. There is talk that without the budget, departments get 45% and then 95%. But of what, Minister? Is it of this year's budget or of what?
It's of what would be expected to be their baseline for this year. So it's 45% initially, up as far as 95%, and that's if there's no executive formed by the summer. There is some ring-fenced monies associated, particularly with the Department of Justice, which they would have access to as well. But the extra 300 million that I've talked about, that could have been spread over to help ease pressures in departments, and of course the bigger budget itself is now not available. So it will really be a care and maintenance budget that departments have to work forward with over the next period of time, until such time as an executive is formed.
Call Gemma Dolan.
Minister, and you've briefly touched on this in a previous question, but the Department of Justice have confirmed that it intends to cut the legal aid budget. Have you engaged with or had representations from the Law Society regarding the potential implications of this?
Yes, I did a discussion with the Law Society last week, I think it was, and they outlined the pressures that they're facing in relation to that. It was a very useful discussion for myself as a Finance Minister. My impression was that the difference between what they needed and what may be available, or the department were advising were available, isn't a huge amount in the overall sum of the department's budget. So I would hope, of course, it's for a Justice Minister, whoever that may be in the new mandate, to prioritise according to their needs. But I would hope that that gap could be bridged between what the Law Society have said is needed to allow people who are struggling to access the legal services and what the department can afford to give them.
Call Peter Weir.
Thank the Minister for his responses so far. Can I ask the Minister, he mentions about the baseline impact in terms of the Department of Justice. Can I ask him, in light of the concerns that have been raised by DOJ and by the police, that the baseline figure, at least as regards policing, does not reflect the money that is currently being spent on policing, that effectively in-year money has had to be drawn in to plug gaps, even to meet the current demand in terms of policing? What discussions he's had with either the DOJ or the police itself as regards the baseline figure currently for policing?
Well, I haven't had any discussions with PSNI, but I have ongoing contact with the Department for Justice, and we're trying to understand and we have had numerous communications with them to get a sense of the issues that they're struggling with in time ahead. And I do recognise, as I've said many times, that if we were to make the offer to health that the parties had said should be prioritised, that does put a stress on other departments. Not a cut, because all of them get an increase, but it's certainly not the amount of money that they would want. So I am happy to continue to work. However, that might inform an incoming executive with the Department for Justice to understand these matters and to see what solutions could have been found. I do think the £300 million that we could have carried over into the next financial year and allocated could have met some of the immediate pressures, certainly in year one, of departments like Justice, and particularly in relation to its funding for PSNI. That unfortunately is now not available to us, but I would hope that there will be an executive back in place soon to take those decisions.
John Blair.
Mr. Speaker, my colleague Andrew Muir mentioned just a moment ago that we were currently operating in a situation where we do not have a budget. But even if we did, the new decade, new approach commitment to an increase in police numbers to 7,500 and to also deliver committal reform to speed up the criminal justice system are still outstanding. How on earth could those be delivered under the current budget proposals?
Well, there are a range of new decade, new approach commitments which ministers do try to meet. And the question is that within every department's budget there is a very significant degree of autonomy for a minister to decide what their priorities might be. And as I say, if this institution decides that health is a priority, that there are big issues in health need tackled, and if that was the outcome of the budget consultation and the final budget process, then that's the budget I had presented to reflect the discussions that had gone on to date. So that undoubtedly does put pressure on other departments, but that's where ministers then prioritise new decade, new approach commitments that were made, and a range of other matters which they consider to be priorities, and they try and match the budget available to them to the priorities they identify.
Neil Bradley.
Question 3.
The Executive's corporate response to the RHI inquiry was published on Thursday, the 7th of October. It sets out the substantial work that has been done to date and those pieces of work still required in a detailed action plan. Work to date includes the revision of codes of conduct for ministers and special advisers and the introduction of guidance for ministers, a better business cases policy and a new guidance on policy making, the people strategy to build the capacity and capability of the civil service, the revised guidance on project delivery and the creation of a project delivery profession within the civil service, new commercial skills and financial awareness training, significant reviews of policy and practice in records management, a revised civil service code of ethics, transformation of the workforce model in the civil service, as well as the policies on civil service recruitment and to workforce planning, and the development of a unified policy for raising concerns.
Neil Bradley, supplementary.
Thank you, Mr. Speaker, and thank the Minister for his answer so far. Minister, can you confirm that all the recommendations pertaining to ministers and their SPADs will have been put in place before any new executive is established?
Well, there are a number of recommendations that can't be implemented exactly as set out, and the independent mechanism for discipline of special advisers is recommended. We're following the recommendation that the discipline of special advisers is the responsibility of ministers, and following the Function of Government Act, that will be in line with the NICS handbook. There are recommendations which will be addressed as part of wider reforms and not immediately as standalone changes without the relevant context, and not as standalone changes without the relevant context being put in place. Some of the recommendations are couched in terms that cannot be affected by making new rules, but simply require responsible ministers and officials to conduct themselves in line with good practice. And the remaining actions have timescales proposed in the response report, and there will be annual progress reports in relation to them.
Sharon.
Thank you, Minister, for the update. Minister, would you agree with me that the DUP, having botched the introduction of the RHI scheme, are now failing to close it in accordance with their NDNA commitments?
Well, I know that the paper was brought to the Executive. It was due to be brought to the Executive before the First Minister resigned from the Executive in relation to RHI. We have been pressing for some certainty in relation to the future of the scheme because, you're correct, the Executive had adopted a position that they wanted to see the scheme closed. That went out to consultation. There are complex legal issues involved in that, but the Executive did want to get back to a position where we could take a decision in relation to the future of the scheme. The paper wasn't in time in order to be considered by the Executive because the First Minister resigned. But I would want to see that matter brought to a conclusion as we had promised before the Executive was put in place.
Steve Aiken.
Minister for his replies so far. Minister, in the light of only one person being disciplined by the NICS Board over RHI, does the Minister think it was appropriate for the Civil Service Board to have taken the disciplinary process decisions without informing ministers or the Executive on this very controversial and cross-cutting issue?
Well, I think you find the timeline meant that there was no Executive in place when the disciplinary processes were begun. There was no, there wasn't, because I know when I came into office where the disciplinary process was sitting. It had already been initiated and that had taken forward the work from the inquiry. The outworking of that is not something that there was a due process there and people were entitled to due process, and the outworking of that perhaps doesn't reflect what the public might have expected from listening through the inquiry, but nonetheless that was the process that was put in place ahead of the Executive return, and I have to respect the outcome of it.
Sure, Dixon.
Speaker, thank you, Minister. Minister, the RHI report makes recommendations with regards to ministerial directions and record keeping, and indeed you're required to take note of those ministerial directions. So can you tell the House today what information you've received to date from the Agriculture Minister concerning his directions with regards to SPS checks of our ports?
Well, we haven't received any as such, but this is now subject to court proceedings. I presume that the matters then become sub judice in terms of the decision that he took or the direction he gave is now subject to legal challenge. I understand there's a court hearing due in the next week or two in relation to that, so perhaps we will get some level of understanding of what his rationale was behind the instruction that he gave to officials. But thankfully, in terms of our own protocol arrangements which we need to take and which the Executive have agreed is the course that we need to follow, the courts have put a stay on his instruction, and we'll see how that then how that is dealt with in the coming weeks by the courts.
Just McNulty.
Question 4.
The last opportunity for departments to submit reduced requirements due to underspends is the January monitoring round. We know from historic performance that departments will not always spend the full amounts that they forecast in January monitoring. This position is not confirmed until the accounts have been audited after the end of the financial year. However, provisional outturn, which provides a good indication of performance, is notified to the Assembly alongside the June monitoring round. Departments do provide a monthly outturn and forecast outturn information, which may provide an early signal as to where underspends might emerge at the year end. This is routinely provided to the Finance Committee. However, at this point, the published January monitoring position remains the latest available.
Just McNulty, supplementary.
For your answer, Minister. Minister, will you agree with me that the cost of living crisis, our constituents are facing, it would be entirely unacceptable for any more to be left unspent, any more money to be left unspent. So what proposals does your department have to deploy any underspent funds to help struggling families who need that money the most?
Well, I have proposals to spend underspent funding that's left to make sure that we don't surrender any money at the end of the financial year to the Treasury. I have circulated those around the ministers. I would have liked to also do allocations for next year. I would have liked to have done a 3-year budget, but that's not now available because there's no Executive. So in the absence of that, I do want to make sure that we spend out what we can, that we carry over as much as we can, so that hopefully an incoming Executive in short term will be able to allocate that money where it's needed next year. So a number of departments, including the Department of Communities, have bid for additional funding, and I've written to other ministers who are left in the Executive, obviously absent the First and Deputy First, to take their view in relation to that. I have to say the response has been largely positive, and so I do intend to propose spending of some £45 to £50 million between now and the end of the financial year across a range of departments.
Melissa McHugh.
Good Concordia, agus just buíthas leis an éire fásta fahaine the Agra Gujisha. Minister, recently you wrote to ministerial colleagues regarding your intention to allocate £45 million this year in the absence of the Executive to the Health Board. Can you confirm if other ministers were supportive of this initiative and if this allocation has gone ahead?
Well, the £45 million that I was proposing to spend was across a number of departments, and it was on the basis that if that money was not spent by the executive, we would exceed our carryover limits. I did want to try and balance that out, because we are in need of a significant amount of additional funding next year, and that would have been used to supplement some departmental budgets next year. So to try and manage that in a way, we had written to other ministers to say, and it was left at the end of the January month round, that we did recognise there was going to be more money coming into the system, and that I would require to take further action in relation to managing that. So on that basis, I did write to other ministers and say this was my proposal. I have to say that the response has been largely positive to date, so I do intend to press ahead with that.
Well, Andrew Muir.
Mr Speaker, lots of the debate thus far in relation to this question is focused on resource spending. We understand there was about £30 million of capital which was unspent, and if that wasn't spent, about £8 million of that would be lost and handed back to Treasury. What progress has there been on allocating that unspent capital funding?
Well, actually, Treasury have redone their books at the end, and they've changed the capital position for us. So they notified us that we would receive 37.4 million less capital than previously advised. So that means that we're now in actually an overspend situation with capital. So it's not a question of trying to allocate any of that between the end of the financial year. We do anticipate, as is always the case with capital, that there will be some smaller amount of surrenders which will even that out. But that only came to us post January monitoring, when Treasury was doing its own books.
Well, Deborah Erskine.
5.
The draft budget reflected the Executive's wish to prioritise health, providing it with a 10% uplift. While this has meant less resources for other departments than they might otherwise have received, no department faced a reduction from their baseline. And furthermore, since the publication of the draft budget, an additional £300 million has been made available for next year. As I set out in my statement to the House last week, the absence of an executive means that the budget cannot be agreed before the start of the financial year. This means departments will not be able to access the additional resources proposed. Importantly, nor will they be able to plan on a long-term basis.
Supplementary, Deborah Erskine.
Thank you. Cuts of 2% indicated by the Minister's budget would create difficult decisions for departments, which they have indicated in the media and at committees. Does he believe that that cut over all the departments impacts upon education, roads, public transport, policing, investment in our businesses? Does he think that that's fair and provides the best services for all our constituents?
Well, it wasn't a case of cuts in Department 2%. Departments were asked to find efficiencies of 2% over the budget period. Every department had an increase with that, even with that, to its baseline budget. Every single one had an increase in spending. So the question is, with finite resources, and it comes prioritisation, because we would love to spend all of the money on all of the areas that you have outlined if we had all of the money to do that. 10 years of austerity budgets from the Tory government have meant that our public services are under a huge strain, particularly our health service. And time again, the people in this institution, the people around the executive table have said health's the priority. We need to tackle the big issues in health. We need to complete and begin the transformation process in health, and therefore we need an opportunity to do that. We now have a 3-year budget, which gives us an opportunity to do that. So the question to people was, do we want to match the actual spend with the rhetoric that people have been indulging in for the last 4 or 5 years in relation to health? That means other departments don't get the level of increase they would want, but they do get an increase. And then it's up to ministers to prioritise within that department where they spend that money.
Matthew O'Toole.
Mr Speaker, Minister, you're right that prioritisation is necessary. You're right that various parties here, including my own, have said that health should be prioritised. But it obviously isn't as simple as simply prioritising health, and then that means that anything else you decide to do goes. Can I ask, Minister, when it comes to the plan now that the DUP walkout means the 3-year budget has been delayed, does that mean that the findings of the Fiscal Commission might feed into a more strategic 3-year budget document which can look at other either alternatives for raising revenue or perhaps more ambitious use of our borrowing powers to fund the next 3-year budget that we hope will be agreed with the new executive?
Well, his initial premise of that you can prioritise health, but then you have to look at other areas as well. That's fine. I mean, that's what the budget constitution was for. But if you are going to give health, you either take back that prioritisation from health, or you increase some departments and decrease for other departments. So that's the choices that you have to make. So it's not a case of we can have motherhood and apple pie. We have to have one or the other. So in relation to the Fiscal Commission's work, we obviously were hoping that it would be before the end of this mandate. It probably would be early in the new mandate. It depends very much on how long it takes an executive to get back into place. If it takes a long period of time and you're back to restarting an entire budget exercise, then that might well coincide with the time frame around that. But I would hope, for the sake of all the people that we represent, that it won't be a very long time before an executive is back in place. There's no logic currently to an executive not sitting. It's not having any impact whatsoever on the protocol negotiations. None whatsoever. So the whole point of walking out and damaging the people of the North has been a pointless exercise in as far as the stated objective it is. So I would hope that logic would lead people back into the executive sooner rather than later. But nonetheless, I do look forward to the work of the Fiscal Commission to see. I think it will contribute substantially to the debate in the next mandate.
Alanya Murphy.
And Minister, would you agree with me that the extra £300 million available for next year, which is now sitting idle as a result of the DUP collapsing the executive, would have been much better utilised in helping relieve the pressures facing our departments?
Yes, and I mean, I would have liked to have been, had I got legal advice, to be able to pre-allocate that for next year to give departments, because a lot of departments and a lot of organisations who depend on spend come from departments are now sitting in a very uncertain position. And I did meetings with the voluntary community sector this morning. I did meetings in recent times with people involved in charities this morning, and people who are relying on that certainty in the next financial year to decide whether they can employ staff, continue to employ staff, continue to provide training and other support programmes, and they don't have that certainty as of yet. And so the £300 million that we had for next year would have gone a long way to supporting some of the departments who were particularly squeezed, and in turn gone a long way to providing certainty to those who rely on funding for them.
Roy Beggs.
Thank you, Mr. Speaker. Would the Minister explain why he stopped the consultation in the draft budget? Because whether it's the current minister or a new set of ministers, you're going to have to start and consult on the draft budget, and you're actually elongating any solution and a finalisation of funding that will be going to departments and ultimately to different groups and bodies and agencies.
Well, as I say, I paused the exercise. I didn't think, I mean, I had engaged, and this morning's exercise was part of that, I engaged in a series of budget discussions with various sectors. That was part of the consultation exercise. And the meetings that I was proposing to have had substantially changed by the fact that we hadn't got an executive to agree a budget. Nonetheless, a lot of them have wanted to continue the discussion anyway. They still have an opportunity to make a response into the department if they wish to do so. But to put all of the departments and all of the arms length bodies through a body of work at this time in the financial year, with the uncertainty that has been caused by the walkout from the First Minister out of the Executive and the collapsing of the Executive's ability to do collective business, then meant that it was a rather futile exercise. So I do hope that we do get back to a situation. What information has been gathered to date will not be lost. It is banked, and people can continue to make submissions if they want. But I do hope that we do get back to a situation where we can pick it up in the near future.
Members not in his place, and move on to Lynn Dillon.
Number 7.
I have sought legal advice on this matter. In the absence of an executive, it will not be possible to agree a final budget for 22-25. That means that departments cannot plan on the basis of a settled multi-year budget. While there are mechanisms in place which will allow departments to continue spending to maintain public services, these mechanisms will not allow departments to utilise the additional resources proposed in the draft budget. This is of particular concern in the Department of Health, which was expecting a full 10% uplift, which funded waiting list, mental health and cancer strategies in full.
Supplementary, Lynn Dillon.
Thank the Minister for his answer. Thank you, Ken Corley. Minister, given the fact that we don't have an executive as a result of the DUP withdrawn from that executive, is there a real risk of underspend? And given what you've just said around health services, and I think we're probably most of us in this chamber in the same position, that we all will have been impacted in some way or another by the loss of someone or someone becoming seriously ill as a result of cancer. And you've just outlined that that is one strategy that is at real risk. Is there a real risk of money being returned to the Treasury?
Well, I'm doing what I can in this financial year to make sure that that risk doesn't arise, and that's why I have written to executive colleagues to propose a level of spend to try and ensure that we manage what we can carry over and what is spent in this financial year to make sure that no money is returned to Treasury. If this situation continues on for a lengthy period of time, then it will be very difficult to spend that £300 million in the next financial year. So I think the imperative is on people to get back around the executive table as soon as they can.
That ends the period for listed questions. We now move on to 15 minutes of topical questions. I call Robin Newton.
Thank you, Mr. Speaker. And I think the Minister knows that around the committee tables there is general dissatisfaction with his budget. But can I ask the Minister, since the Sinn Féin collapsed the Assembly for 3 years and we came back for the past 2 years, within the Education Committee there has been a considerable amount of discussion on special education and needs provision, both revenue and in capital. Can I ask the Minister why there is no annually managed expenditure? Why Amy is not mentioned as a special area of special educational needs investment within his Northern Ireland supplementary estimates?
Well, I will certainly come back to him in relation to that. I'm happy to write back to him in relation to the reason for that. Just say that when the Executive did collapse in 2017, there was a solution, a deal on the table in February 2018 to return to the Executive. Your party rejected it. They returned to the same deal 2 years later and accepted it. So 2 of those years were down to yourselves, and we can go over the whole history of the RHI if he wishes. I do understand that this is a budget consultation process that has been going on. That means that all of the challenges and difficulties that will arise from budget will be discussed around committee tables, will be discussed around arm's length bodies and all of that, because we don't have the resources for everyone that we want to give to everyone. And that's a consequence. Your own party supported and kept in government an austerity Tory government and the option of putting in a Labour government instead, where they opted to choose to support Theresa May in her government. So those are the consequences that flow from that in terms of our overall budget spend. And so we haven't got the ability to do all that. But we will have to come back to a decision to decide what we're going to do, what our priorities are. And we know in doing that that there are other areas that don't receive the level of funding they might otherwise have wanted. And that was the choice that was faced. And that's what every executive has done, is to face. I don't recall any executive since 1998 having all of the funds that they wanted. So we have to make priorities and have to make choices. I will come back to him on the Amy question, though.
Supplementary, Robin Newton.
Thank you, Minister, for his response. Minister, you see, it is a simple question, and it's a question that I raised with you 12 months ago in the debate around the budget as to why there was not a line in the budget, an Amy line in the budget for special educational needs provision. And at that stage, you indicated to me you would consider the matter and come back to me.
Well, can I say that I have done quite a degree of consultation with the Education Department in relation to the draft budget, and that issue hasn't been raised with me. So I am quite happy to look and see why that is the case. I can assure you, and I'm sure you would expect, that myself and any other finance minister will want to get as much into our budgets as we possibly can, and if there's another method of achieving that through Amy, I certainly would be very happy to explore that. But it's not an issue that has been raised with me as a significant deficit by the Department of Education.
Constable McAleer.
Will the Minister agree with me that the British Government should reconsider its plans to restrict the use of rebated red diesel?
Sorry, I didn't catch that.
That the British Government should reconsider its plans to reduce the use of rebated red diesel?
Yeah, I mean, I do understand that we have all of a responsibility to try and engage with policies and proposals that would help reduce the damage to the environment, and this is included in one such proposal. I do think, though, there are unforeseen consequences of that in terms of farms, of small contractors, and I don't think that viable alternatives have been put in place or even any support mechanisms to move people away from that. It's really a very short, sharp reduction in relation to that, and I have no doubt that he and many others around the Chamber have been lobbied in relation to that over the recent weeks and months. I have engaged with Treasury in relation to it and asked them to reconsider that proposal and outlined the effect it was having certainly on our agriculture and other sectors here. As I say, contractors are affected also, and while we do want to make a contribution to climate change support for ensuring that we undo some of the damage of climate change, I think we also have to do it in an organised and structured fashion that we can bring people with us and make sure that people are able to make the changes that are necessary.
Supplementary, Declan McAleer.
I thank the Minister for his response, and I think the Minister will agree with you. It is clear that restricting the use of red diesel, it won't reduce emissions alone because at present there are not sufficient alternatives to this here. But would I also agree that if the British Government continues with these plans, that the hardest hit sectors will be small businesses, construction, manufacturing and indeed the agri-food sector, which indeed will place jobs at risk as well in all of those sectors?
Well, I know that we certainly have been hearing loud and clear from those sectors as to the consequences for them. And as I say, well, we want to ensure that we play our part in reduction of emissions and meeting climate change targets. I'd say that those have to be done in a way which people can engage with. And it seems to me that there are unforeseen consequences to the British Government's action, and that's why I have raised with them that proposition and asked them to reconsider that.
Members not in this place, I'll call Stuart Dixon.
Much, Mr. Speaker, and thank you, Minister. Minister, what additional funding are you planning to deliver for Northern Ireland's 3 airports beyond that funding already allocated for air connectivity?
Well, one of the propositions that was agreed in the draft budget paper, there were a number of things were actually agreed and others were noted, and that's why we can't proceed with the actual budget itself. But one of the propositions that was agreed was for a rates holiday continuation in the next financial year, and airports are included in that 3-month rate holiday, and they have obviously received significant support. They are starting to get back to more business, obviously, since the pandemic has begun to recede somewhat, but nonetheless they are continuing to struggle. It's a very sort of high-risk business in terms of the profit margins in relation to it. So the responsibility for airports isn't as clear-cut here as you would have in another jurisdiction. So Department of Finance has been playing a role, Department of Infrastructure has a role, Department for Economy has a role, and we've been trying to engage specifically with Derry Airport in relation to its business case for the time ahead. But we will continue to try and engage with the airports and see what support we can. But from a finance perspective, we've been able to include them in that 3-month rates holiday coming into next year.
Supplementary, Stuart Dixon.
Thank you, and I appreciate your answer, Minister. Minister, the United Kingdom Government recently announced an airports and ground operations scheme to support the regeneration of airports following the COVID pandemic. What share will Northern Ireland get of that funding, and how do you plan to have it distributed to the airports?
Well, we're not sure as yet as what it will be. Sometimes from an announcement in Britain it takes quite some time to find out if a Barnett flows our way at all, and if it does, then how much that will be. Then that requires an executive discussion to actually decide that because we don't necessarily have to spend that on for what it came across, for the reasons it came across. And so I would be afraid that in the absence of executive we can't take any decisions should we be aware in the near future of what Barnett consequential might arise from that decision. But we will keep across it, and obviously I've been very committed to working with the airports over the last couple of years, and we've very good working relationship with them, and we will continue to engage them to try and support them in whatever way we can in the time ahead.
I call Patty McGlone.
Could I ask the Minister if, in fact, or if he could advise if it's intended that there be a rates holiday for businesses this year?
Yeah, I suppose just to follow on from the last question, one of the issues that was agreed in the draft budget paper was that as a consequence of the a sort of compensatory factor that came across as a Barnett consequential, all businesses will receive a 1-month rate holiday. That will be the month of April in the new financial year, and that targeted business sectors including retail, hospitality, airports, childcare sectors, newspapers, some of the sectors which we have agreed and have done some policy work on have been hardest hit by a pandemic, will continue to struggle to recover. They will receive a 3-month rate holiday which will bring them up to July.
Supplementary, Patty McGlone.
So, just to get it perfectly clear, Minister, all businesses 1 month, and those particular sectors you just announced 3 months. Is that correct? Thank you.
Yeah, that's correct. There is a compensatory issue where people could have claimed, because of the pandemic, could have actually claimed compensation back on rates. But we had already compensated people for the impact of the pandemic, so it would have been a double receipt in that regard. So we brought through legislation to close off that opportunity. But as a compensatory factor, there was 50 million Barnett consequential came across. We decided to use that for 1 month for every business to recognise that there was some loss their loss of a right in terms of claiming compensation, although they had already been compensated, but also then to continue to recognise that those sectors like retail, hospitality, etc. were continuing to struggle.
Now the next two members are in their place, and I call Melissa McHugh.
Margaret Concordia, I'd like to apologise as well for referring to the Health Board the last time, when in fact I did mean other departments and so on. But this time, Minister, I am returning to health, and I've been contacted by many constituents, and I think that many other MLAs are the same, worried at reports of the waiting lists and how they're going to continue to grow as a result of the DUP's action and bringing down the executive. So, Minister, have you looked at alternative ways of actually funding the health services?
Well, the primary means to fund our health service is the budget, and where we had put in place a draft budget over 3 years with a significant, as I say, 10% uplift for health in the time ahead. Health, we're planning on that basis to tackle the waiting list issue, to fund in full cancer treatment services, to fund in full mental health services, and also to begin the transformation of health, which has been talked about for many, many years and is long overdue and actually needed in terms of trying to get under control public spending in relation to health. So none of that is possible now in the time ahead. There also was, if you like, a Barnett consequence to come across as a consequence of the national insurance increase in Britain. And we've been engaging with both Treasury and with legal advice to see can that Barnett consequential come straight into health rather than have. But our advice to date is that it has to go through an executive, so that may well even jeopardise that money that was going, that national insurance contribution, which was used to increase funding in health in Britain, may well get stuck in the logjam because of no executive here. So I'm hoping that won't be the case, but the advice that we have to date is that that is very likely to be the case, that we don't have an executive to be able to give health that uplift. So you can see that all of the plans to try and give health significant support have been stymied by the absence of an executive.
Melissa McHugh, supplementary.
And Minister, I'm sure too that you would agree with me that it's an absolute disgrace that at a time of a pandemic, that because of this reckless decision was by the DUP to bring down the executive, that funding won't now be available, in particular, for the cancer services and the mental health strategy and the other needs that exist within the whole health service currently.
Well, the strategy might have some logic attached to it if it was having an impact. But the negotiations, as far as I can see, and I'm sure as far as anybody who's sitting around here can see in relation to the protocol, are going on undisturbed and almost oblivious to what's going on over here. So the strategy is not having an impact, apart from impacting on the people that we represent and people who are on waiting lists and people who are desperately seeking a better health outcome. So I would say to those who have decided to bring down the executive, if you want to protest against what's going on in relation to the protocol, bring that protest to where it has some impact, bring it towards the discussions, bring it to the British Government, bring it to the European Commission who are conducting the negotiations. Don't impose penalties on the people that we represent here, because it doesn't have any outcome in terms of the discussion on the protocol itself.
I call Just McNulty. The member may not get a supplementary.
Minister, I find it quite extraordinary. Just weeks after the announcement on the withdrawal of emergency surgery from Daisy Hill Hospital, your department is announcing handing back money to the Treasury. Surely some of that money could be apportioned to the Trust to enable them to facilitate a widespread recruitment process to ensure we can get the surgeons into Daisy Hill to have our surgery, our ED 24/7 surgical access in our hospital at Daisy Hill.
Well, I'm not quite sure where the member got the information that we're handing money back. I spent about the last hour and a half explaining I wasn't intending to hand any money back to Treasury. Perhaps explaining and repetition is required in some of these things before it eventually sinks in. And the other fact is that the Health Department, who would need to bid for additional money to deliver it to the trusts to do whatever the trusts want to do, haven't bid for any money at the end of a year. Either. So my ability to foist money on the Health Department and on the Trust to do recruitment is limited, regrettably perhaps on some occasions, but the fact is his initial premise that we are handing money back is completely false. We are spending the money that's available at the end of the year. We are ensuring that whatever happens in terms of an executive in the new financial year, that they will have £300 million at their disposal. And I would hope that whatever executive comes in does engage with the budget that I have proposed, because that does give health the uplift to do the sorts of things that he's talking about across all of the health sites that we have, including Daisy Hill.
And time is up, members. And members, please take your ease for a moment or two before we move on to the next item on the order paper. Thank you.